So, we've talked a lot about the problems of the American healthcare system, and I think it's worth spending a little time discussing the roots of those problems. And one way to start is to actually tell a little story. Once upon a time, there was a small village on the edge of a river. The people there were good, and life in the village was good. One day, a villager noticed a baby floating down the river, and the villager quickly swam out to save the baby from drowning. The next day, the same villager noticed two babies in the river. He called out for help, and both babies were rescued from the swift waters. The following day, four babies were seen caught in the turbulent current, and then eight, then more, and still more. The villagers, being good, thoughtful people, organized themselves quickly. They set up watchtowers and trained teams of swimmers who could resist the swift waters and rescue babies. Rescue squads were soon working 24 hours a day, and each day the number of helpless babies floating down the river increased. The villagers organized themselves efficiently. The rescue squads were now snatching up many children each day. While not all the babies now were very numerous could be saved, the villagers felt that they were doing well to save as many as they could each day. And the village priest blessed them in their good work. And life in the village continued on that basis. And then one day, someone raised the question, where are all these babies coming from? Let's organize a team to head upstream to find out who's throwing all these babies into the river in the first place. Now, this is, of course, a parable about our healthcare system. We have sickness insurance, not health insurance. We spend so much time rescuing the babies who are drowning in the river that we never go to look and see, well, why are they drowning in the first place? This really goes beyond simply preventative treatment versus emergency treatment. It has to do with where we spend money. And if we spend money properly, we're not spending it actually just on healthcare. We're spending it, as we conceive it narrowly, we're spending it more broadly. Education, nutrition, environment, poverty, racism, all of these things affect health. We keep treating the symptoms of our illness and not the problems, not the causes. And those causes are cultural, they are structural, they are not simply things that medicine itself can handle. And yet we keep asking our healthcare system to do just that. What are some of the problems? American attitudes, private insurance, fee-for-service system, a lack of standardization, and powerful drug companies. So let's kind of look at these. We have that lack of cost standardization. And what this means is the same procedure that is done in one hospital can be worth thousands of dollars more, or can cost you thousands of dollars more at another hospital. So looking at this example here, if you are going to have a surgery dealing with obstructive pulmonary disease, it can cost $14,505 at Metro West Medical Center. But if you go to Brigham and Women's, just down the road from Simmons, it's going to cost you $52,729. Is the standard of care that much better at Brigham and Women's? I'm not sure it is. Mass General's no bargain there, by the way, at $49,000. $239. So we look at this and we can say there is no standardization across the different hospitals. And this isn't a market the way I might compare costs of computers if I'm buying a new computer or a phone. It's certainly not, we're not in a position as patients to be the kinds of thoughtful consumers that the market often assumes that we are. I can't do this kind of research. When I check into a hospital to get care, I am not actually able to know how much it's going to cost in advance. And I probably haven't done my research to find out I might be better off going to Metro West Medical Center over Brigham and Women's. Another problem that we have is American attitudes. And these are the things that prevent us from dealing with a lot of our problems. One is this idea of rugged individualism, that we're all not in this together, but on our own. And if you think about that cowboy out in the American West, think of your Marlboro Man ads, that idea of Americans as solely responsible for themselves means that we don't actually look at collective solutions, and we don't look at collective responsibility and collective problems. And health really is a collective issue that we have to deal with. Another attitude that prevents us from dealing with this is really a discomfort with death and dying. Americans have traditionally done everything to fight against death and dying and not really recognized it as part of life. There's some interesting things that have gone on with coronavirus as the death toll gets higher and higher, and there seems to be a numbness to this. It's actually one of the things that, as an observer of American culture, has been really surprising to me. And deeply concerning as well. As much as I think we need to be able to talk about death and dying and understand that it is part of the life cycle, the way we went from fighting it at all costs to merely accepting a daily death toll of 4,000 people is pretty shocking. We can talk more about this in our live session. Lastly is a faith in market-based solutions. We have this idea that the invisible hand of the economy is going to come in and provide us answers, and that healthcare services are just like any other service, and the market is the best arbiter of that. But as I mentioned in the previous slide, there are real problems because this isn't a market the way other markets are. We are not in a position to research and compare different treatment options, especially when those are imminent. When you get that bill for $700,000 from your stay in the hospital, it certainly isn't because you planned on spending that much money or that you could have avoided it. Sometimes you get hit by the bus and you don't get to choose which hospital you're taken to. Another element here is that we have private insurance, and private insurance, these are private businesses and they are profit driven. Their goal is to make money, and that introduces all sorts of pressures that have nothing to do with health. Along with this private insurance, we also have really high administrative costs that go with it, both in terms of who gets paid in an insurance company, but also in hospitals and medical offices. There's always a business manager whose job it is to figure out the different reimbursement rates for different insurance companies and navigating that, because there's no standardization across that either. So it imposes a great deal of extra costs into our system. Part of this is also that we have a fee-for-service model. This incentivizes testing. So if each blood test someone runs brings in money for doctors, they're going to run more tests just to help their bottom line. what is it that we are so worried about? We've got to have all of these tests. Sometimes they give you important diagnostic information, but sometimes it's just there to pad the bottom line. We have a preference for specialists. Specialists are more expensive than general practitioners, which is why you'll have many more doctors going in to specialties because it's one way that you can pay back your medical school loans. A lot of this, though, could be handled by your family physician, your primary care physician. We also have this fee-for-service model, and I'm going to contrast it with a bundled model. In a fee-for-service model, with that testing, every test you get gets paid. So when you get your bill from your hospital stay, that money, you have fees that go to the doctor who treated you, who referred you perhaps. You have the radiologist who looked at your scans. You had the anesthesiologist who put you under when you were in surgery, and then separate payment as well to the surgeon. Each of those separate items. Compare this to a bundled model where a bulk sum of money is given to the hospital, and the hospital then decides who gets what portion of that. That's going to keep costs lower, but generally we haven't done that as much. We also don't use pay per performance, where instead of being paid for all the procedures you do, physicians in this model would be paid for the outcomes of that performance. We also have powerful drug companies. We spend a lot on prescriptions, and you can see in this chart here that we have been spending more and more. This explosion in drug prices and cost, the amount we're spending, and part of this has to do with the introduction of new and expensive drugs. So look at these drugs for treating hepatitis C at the top there. $81,000, okay? And that is treatment for really a year. That's it. But you will need this every year. You cannot afford these drugs without insurance, and we don't allow the federal government to, outside of the VA, to negotiate prices. You can have the same drug here cost 10 times, 100 times what it is, the rate it's being charged in Canada, which is why pre-pandemic you had Americans taking bus tours up to Canada to get their prescriptions filled. That is a truly broken system right there. And in addition, we really have no price controls on those drugs either. So we can see this sort of explosion of, a drug that you're used to starts at $100. And then there was several years ago this explosion where suddenly it's $500 for an EpiPen. And these are drugs that, everyone needs. Anyone who needs them needs multiple ones. Certainly any child going to school has to have an EpiPen not only for home, but for school. At $500 each, this is prohibitive. Another thing that can happen is that you can have drug companies buy another company, come under new ownership, and take drugs that had been low cost and simply jack up the price. So we can see here some examples of those. So like doxycycline, which is used to treat Lyme, it's an antibiotic. It cost $20 in 2013. And when it came under new ownership, they raised the price to $1,850. I mean, $1,850. That's insane. And those sorts of things, we have no rules about this, no price controls. All right, in our next slide deck, we'll be talking about some basic healthcare terms that will be useful for you to know.